Hi, I'm Bahar Etminan. I'm delighted to introduce you to Dr. David Topchian from Cosmetic One. Dr. Topchian is one of Australia's leading cosmetic surgeons, and he's here today with us to share his expertise and take on the role of skin and skin care in particular for achieving your best anti-aging results. Dr. Topchian, I'm so fascinated by your premise that you're an advocate for changing people's psychology and confidence before any treatment is given in your clinic. Tell me more about what you're doing.
We need to understand what the concerns someone has are, and then to see whether we can match our treatments to those concerns so that they get a great result.
So that's kind of a psychological
Yes.
expectation?
Yes, it's really trying to psychologically understand where the person's coming from and to see whether what we are able to do, whether that will achieve what they're after.
And you mentioned to me before that you think that social media is creating a bigger and bigger gap in what people think they want and what you, as a cosmetic surgeon, would recommend.
Well, social media has really distorted people's perception of themselves, for one, and other people as well. So I think it's important to understand where someone's coming from and help them achieve the best result for them rather than comparing themselves to someone else. It's, how can we help them look their best?
Dr. Topchian, I am so fascinated with your work in achieving a positive mindset and healthy psychology before you do any procedures on your patients. Can you tell me a little bit about what we were talking about, the body dysmorphia?
Sure. Well, it's quite a common problem in the community, and we need to make sure that the people who we're seeing, that we can actually help with the procedures that we do. So if they need a procedure or that can help them, we will discuss that with them. If we don't think it'll help, we might offer them other treatments like counselling or other alternatives.
And where do you think this kind of disparity between what patients think they need and what they really should have comes from?
Well, in one word, it'd be the internet, but social media is a confounding factor. So people, I guess there's a lot of information online. People read and they believe that they know what they need, but they can't be objective about themselves. They don't have the experience or training.
So on the subject of client satisfaction, how important is the role of beautiful skin in achieving that overall 360 transformation of a patient's anti-aging result?
Well, it's probably the most important part, because people's skin reflects their health, and things like luminescence, the pore size, red pigment, brown pigment. If those things aren't optimised, then you're not going to get the best result.
So you can virtually have surgery or fillers or any work
and not look any better or younger. You just look different.
Speaking of patient satisfaction, in your opinion, how important is skincare and good skin in prepping for your procedures and overall client satisfaction from the procedure?
We find that we get the best results in my clinic by working with people to determine which skincare products are best for them at that time, at that moment in time. Because everybody can get skincare from the supermarket to the department store, but it's more about having somebody who's expert and who knows your skin recommend a regime that will work the best and optimally for you. A number of studies have shown that skin is really the most important part of facial rejuvenation and looking well and healthy. So we can do all the tricky, fancy things that we want in terms of lasers and other procedures, but if the skin doesn't look healthy and it doesn't look glowing, then we're really not doing our best. So it's important that patients have the right prescription, have the right products, and continue them at home.
It's wonderful to speak to you as a cosmetic surgeon. I'm really curious to get your take on the role of antioxidants and vitamin C in the preparation and post-surgery phase of anti-aging.
Sure. Well, we utilise vitamins A, C, E and other cosmeceuticals to prepare someone for a procedure because we find that they heal a lot better if their skin's healthy. And then obviously afterwards it's really important for them to maintain that regime so that they can look their best for longer. So for our clients, we choose a skincare regime about a month before their procedure, and that's tailored to that specific person. So we make sure that we're really optimising their skin health to get the best result for them. So we make sure that we recommend products to our clients that have been scientifically tested and proven as that formulation, not just as an ingredient.
Now, of course, you're a cosmetic surgeon, so we expect a lot from your skills. But what role do you think antioxidants and vitamin C play in the before treatment and post-treatment phase of achieving the results that you want?
Well, I've absolutely no doubt that the results that we achieve in my clinic, that through my procedures or through our laser treatments, are enhanced and optimised through good use of skincare products about a month before treatment, and then obviously at home with the at-home care regime.
So in terms of antioxidants and vitamin C, where would they fit into that pre, during, post timing?
Yeah, so absolutely antioxidants and vitamin C are important in both the lead up to having a procedure in terms of preparing the skin and the tissues in general, and then afterwards also really important to heal, the recovery time, and also in the rejuvenation effect of the treatment.
Dr. Topchian, what is the role of at-home care in relation to a clinical procedure, before care, and then the result that you can expect to have in the long term?
It's important that we choose the products, the aftercare for a patient that's tailored specifically to their circumstances, their procedure and their skin type, to make sure that they really continue to improve after the procedure for a long time.
And to close the loop, what do you think is the relationship between clinical procedures, injectables and at-home skincare?
Well, they're all, they will have a place. I think it's really important, if we're focusing on skin, not just to look at plumping features or lasering. I think we need to look at skin clarity and skin health, all of which are helped by having a preparation before a procedure and having great at-home skincare products that have been custom tailored and selected for you.